Hello, I'm Dr. Van Ryn from Christian Hospital, and welcome to a presentation on the accelerated joint rehabilitation pathway. 4 years ago, I began having progressive arthritis in my hip, and I got to the point where I could no longer do my active lifestyle or my professional life. I realized that I would have to have a hip replacement, and I thought maybe this is the time to start thinking about ways I can make this whole process better. If it works for me, maybe it'll work for my patients as well. So in collaboration with my surgeon, this is what we came up with, the accelerated joint rehabilitation pathway. If at the end of the video you have any questions, please don't hesitate to call me at the office and we'll talk about the accelerated pathway. Thank you.
The Accelerated Joint Rehabilitation Pathway is a comprehensive program that is designed to shorten and maximize your recuperation from a joint replacement. This approach combines preoperative physical and occupational therapy, the use of a long-acting spinal anesthesia combined with intravenous use of a strong aspirin-class medication to minimize the need for narcotic medication, acute postoperative cooling therapy, and thorough and focused postoperative rehabilitation. Research shows that increasing mobility before surgery makes accessing the joint easier for the surgeon, and increasing strength results in a faster recovery for the patient. Prior to surgery, you'll have meetings with physical and occupational therapists who will give you the instruction you'll need to prepare you for your surgery and recovery. They'll prescribe strengthening exercises and train you for proper form, duration, and frequency. You'll also be trained in the proper use of a walker and cane, both on flat surfaces and stairs. They will also provide instruction on making and using ice packs to minimize post-surgical pain and swelling. Lastly, they'll provide assistive equipment demonstration and training to help you at home with dressing, cooking, and bathing, as well as bathroom and car transfers. Knowing what to expect before, during, and after surgery can help you recover more quickly. That's why you'll be coming in a few days prior to your procedure for pre-admission screening, testing, and orientation. During this visit, you'll discuss your health history and options for anesthesia during your operation. There are two types of anesthesia most typically used: general and spinal. You and your surgeon will decide which option will be best for you. A member of your surgical team will also visit, going over with you what to expect the morning of surgery, including what anesthesia you've opted for. Then you'll discuss the procedure in detail and get any questions you may have answered. In this footage, our specialist is discussing a knee procedure with a patient. On the day of your surgery, you'll be admitted to the hospital, and then you'll be shown to a room where you'll be gowned up and prepared for your procedure. As you await your surgery, you'll be greeted by members of the surgical team. For your safety, your proper name, procedure, and correct site will be confirmed multiple times during this process. At this point, the extremity to be operated on will be marked. Once you're in the OR, you'll be connected to the equipment that will allow your surgery team to monitor your vital signs, and your anesthesia will be administered. Your safety, health, and comfort are uppermost in the minds of every single professional entrusted with your care. Accordingly, your procedure will be administered under our time-out protocol. This is designed to ensure all the details of your surgery have been determined, confirmed, and that all the appropriate safety steps for your procedure and care have been strictly followed. Upon your arrival at the 10th floor after surgery, you'll be greeted and cared for by a team of highly trained orthopedic and joint replacement professionals. They will assist you during your postoperative stay, through your discharge from the hospital, and they'll even be involved in your rehabilitation.
Hi!
After you've reached your room, members of your nursing team will introduce themselves and help orient you to your room. Your team will do everything that they can to manage your discomfort. The goal is to get your pain controlled so that you can rest and take part in physical and occupational therapy. you may receive pain medication through your IV, oral pain medication, or some that you can control yourself by pushing a button. An ice bag or cold therapy unit is also kept on the joint area to lessen pain and to help decrease swelling. Your pain will lessen every day. Throughout your post-op stay, your vital signs will be checked hourly to ensure your safety and comfort. A thorough head-to-toe assessment will also be performed on your admission and at each shift. During your assessments, we'll also examine the surgical site and check for proper circulation. You will wear snug stockings and compression sleeves to aid the blood flow in your legs to prevent blood clots. You will also be given medication to reduce the chance of a blood clot forming. The nurse will also explain your pulse oximetry monitor, which will ensure your oxygen levels are stable during your stay.
So we'll just pick a goal.
You will also do deep breathing and coughing exercises and be using an incentive spirometer every hour that you're awake. This is done to expand your lungs and help get oxygen to your tissues. As part of your room orientation, you'll also have access to a communication board to give you a detailed overview of your team and how to contact them should the need arise. Active movement after your surgery helps to prevent possible complications, although you are never to get out of bed by yourself. You will have a call light to use to ask for assistance. Remember, call, don't fall. You will be assisted out of bed the evening of your surgery, and you will use a walker to help you walk. Your nurse or patient care assistant will assist you to the bathroom using a walker. Anesthesia and pain medications can cause constipation, so drink plenty of fluids and eat whole grains, fruits, and vegetables. A stool softener or laxative can help normal bowel function to return. The day after your surgery, your inpatient physical therapist will introduce herself and perform a pain assessment before any therapy. It's important to perform leg exercises to help your blood circulate and help your new joint obtain motion. You'll know many of the exercises already since you did them at home prior to having surgery, and your therapist will also teach you more of them. Remember, your surgeon gave you a new joint, but only you can make it work. For your safety and convenience, our orthopedic unit on the 10th floor houses a satellite therapy unit, so you'll benefit from additional post-operative therapy right on your floor near your room. You and your therapist will work on basic mobility and normal range of motion exercises. Repeating these exercises throughout the day will help you gain important strength and mobility. You'll also be trained to perform a transfer into a car to prepare for your discharge. You will discuss your discharge options and needed equipment with your case manager and social worker. If you meet your therapy goals, you'll be discharged to go home with home health visits on the 2nd to 3rd day after your surgery. Since mobility and strength is essential to your safe recovery, if you have not met your therapy goals, you'll be discharged to a skilled nursing facility and will continue therapy until you're strong enough to go home. We know you have many choices for where you receive your care. Thank you for choosing Christian Hospital Orthopedic and Spine Surgeons.